Singapore was one of the first country to have a COVID-19 case outside of China. I think that comes from the fact that we are a travel hub in Asia. The way we saw it was quite interesting as the virus unraveled to us, right? Because when we first started, we were kind of ready because we have been preparing as a national center for infectious disease for H1N1, Ebola, Zika, SARS, and everything else. So it's nothing really new to us. So we did some revision on the PPE, mask fitting, and things like that. But what was so different about this virus is that it slowly unraveled to us in the sense that first we started with no community cases. So the cases were in controlled clusters, and we could do contact tracing, isolate them. So this made the delivery of hospital services very straightforward. You have COVID cases, you have non-COVID cases. You physically separate them. We do the COVID cases in a separate facility. We do the rest of patients in one facility. So that was when there was no community spread. Then it came that we had community spread, and there lies the challenge for IR because there's a real possibility that you have to protect the staff, you have to protect the patients from each other. The person who walks in for like ablation or embolization could very well be a COVID positive patient because it's now in the community. So that strategy changed a lot in the sense that we have to really step up on our cleaning of areas, even with non-COVID suspected cases. We also have to as well do precautions on patients. I think one of the things that's not often mentioned in all the papers out there about COVID prevention is that the most effective way we learn from all our previous infectious disease is that you just have to put a mask on the patient while they're in the room. And that's really very effective in reducing the footprint and everything else with their droplet footprint. And so that's what we started. Like, and it was way before mask was mandatory. We say every patient who get a procedure, since you have community spread, we gotta put a mask on them, right? And we do our cases, our TASE, our embolization, and everything else. And the second thing that came that really kind of expanded the works is when we realized that there is such a thing as an asymptomatic spreader. Because we could be screening patients in the clinic before they come to the hospital for temperature, but there's of modest efficacy when you have patients who are asymptomatic and they could spread. So these are the ones that really kind of made us have to adapt to new information that comes along, and that's how we actually cope with it in the sense that we have to be very responsive. Every time we learn something new about the virus, we have to react to it and put in measures to protect patients. The moment we knew that it was coming, we did have stoppages of leave, vacation. We canceled academic activities like teaching and stuff. We also canceled travel for conferences and stuff. So in terms of manpower, we actually had more manpower than ever. So then, and that helped boost the extra services we need. Now, with regards to conservation of resources, so we were very judicious about PPE because there was a global supply chain disruption to PPE, and countries were fighting for it at the start. I mean, now it's not a problem. So we did have rules on how long we can use a surgical mask, how many times you should reuse a N95. We did not even have 3 days of leave vacation time until maybe about 3 to 4 months into the pandemic. So before that, there was absolutely no one could go anywhere, right? Except for medical leave or you get a quarantine or something. I think that there's a real impact to it. I think one of the most powerful message that we could send as a unit and as an institution is to have a lot of guys like us who have gone through SARS, right? And told them, look, we've been through it. We know it's not an easy time, but we are alive. We didn't die. We didn't bring back our family and everyone got infected. So that kind of messaging is important.